Hi everybody, my name is Brittany Walls, and today I'm going to be demonstrating how to do the procedure for a venipuncture blood draw. So before I begin, I would just start with a little bit of information on how venipuncture started. About 3,000 years ago, dating back to the Egyptians, venipuncture blood draw was used for a medical treatment known as bloodletting. And bloodletting is the withdrawal of blood from a patient to cure or prevent illness or disease. And an interesting fact is that George Washington actually had bloodletting performed on him in an effort to cure a sore, swollen throat. He came in from being outside one night with a sore throat, went to bed, and his throat almost swelled completely shut. So his doctors were trying to treat that with bloodletting. Unfortunately, they bloodlet him about 40% of his total blood volume, and they say that might have been what killed him. It's unknown because they did many obscure medicinal treatments on him that night, so that may have been the one that killed him, but we're not for sure. So moving forward, I have some key topics I'd like to talk about for venipuncture blood draw. The first one is verify your patient's information. The second one is personal protective equipment. And then the third is choosing your venipuncture site and the equipment to do so. So first we're going to start with verifying patient information. That starts with correctly labeling your specimen. When your patient arrives, you want to ask them their last name, how to spell it, and their date of birth. And you want to make sure you look at the labels to verify the information they're telling you is correct. Next, you want to make sure that you're wearing the right personal protective equipment. Personal protective equipment is so important in the healthcare environment. It protects our mucous membranes, our airways, our skin, and our clothing from infectious substances. And we basically use standard precautions with all specimens, just meaning that we basically treat every specimen as if it's infectious, even if we don't know if it is, just to protect ourselves. So today's procedure requires a lab coat and gloves for our personal protective equipment. So I will be wearing those. And next, I'd like to talk about the venipuncture supplies needed. We will need hand sanitizer to use before we do the procedure, gloves and lab coat, your biohazard box here, it's also located next to your station, a tube rack, which is here, and the evacuated tubes, depending on the draw that you need to do, depending on what tests are needing to be run, there are multiple different tubes, and I will talk about that in just a moment. Next is our tourniquet. Our tourniquet is used to slow the blood flow back to the heart. That way the veins become more prominent, so they're easier to see, feel, and stick. And this is the tourniquet here, and that's actually placed about 3 to 4 inches above the site where you're going to do the venipuncture. We only try to leave that on for 1 to 2 minutes, and then remove that after we locate the vein, and then we will try to leave it off for at least 2 minutes before putting it back on and doing the actual stick. So next, let's talk about the needle selection. There's 3 different sizes of needles that we typically use. The 21 gauge, which is our largest, is for most adults. 22 gauge is for small adult veins, older children and syringe draws. And then our 23 gauge butterfly is used for hand veins, smaller children, or for small adult veins in general. And then next we'll talk about the tubes. So each tube has something different in it. Some have anticoagulants, some have coagulants, and some have nothing at all. So the order in which you draw the tubes is very important, that you're not cross-contaminating any of those into the wrong tubes. So I have the order of draw here. The yellow tube will go first, the blue tube, the red tube, the gold tube, the green tubes, lavender, and then your gray. So today we're just going to do the pink and the lavender, which are right at the same level, so it doesn't matter which one goes first. So next, let's talk about choosing the proper venipuncture site. So we're going to be choosing the median cubital vein here. It looks like about an M shape. It's where the cephalic vein and the basilic vein actually meet. And the reason that we don't do the basilic vein, which is located on the pinky side of the arm, is because it's in close proximity to the brachial artery and the median nerve. So we don't want to hit either of those if possible. So right here is the diagram for that. And then we're going to talk about how to insert the needle into the vein. We want to place our hand just like this diagram. You want to put most of your hand behind the person's arm, and then use your thumb to hold down the vein below the site, and basically just keep it right where you need it so the vein doesn't actually roll. And then we're going to insert the needle in a 15 to 30 degree angle depending how deep the vein is underneath the skin. So it's a nice little diagram that I have here, and actually the needle needs to go into the lumen of the vein, which is the inside of the vein, so the blood flows nicely. So I just had a couple pictures of some of the supplies that we'll need to use right here. I think I also forgot to mention a couple things. The needle and the vacutainer, the needle is double-ended. This part's going to go into the arm, and this part here actually goes into the vacutainer, which holds the tube. So there's actually another needle here covered with a sheath, and that sheath will move upward when the tube is put on the vacutainer, allowing the blood to flow into the tube, and then the sheath comes back down so that the blood doesn't keep flowing when we switch out tubes. The alcohol wipe is actually used to disinfect the area. That way none of the bacteria on the skin, if there is any present, goes into the actual vein. And then we use medical tape, Coban, or a Band-Aid afterwards to stop the blood flow. That way the person's area can clot, and then the patient labels for the tubes. And then I mentioned that we do the verifying patient information after the blood draw as well. And with that, we just, we want to label the tube. We'll already have the patient's label with their first and last name and birth date. We want to add the date, the time, and then my initials as well. We will also show these tubes to the patient to make sure that's actually their information. They verify that for us. So I'm just going to pause real quick while I get set up for the blood draw, and then we will do that.